When your home pregnancy kit confirms as positive, you are definitely pregnant. But all things might not be well. There may not be any pregnancy inside the womb. In fact, it may be outside the womb. Number two, there may not be any babies. Only the placenta is formed, which is causing the test positive. There may be a baby without any heartbeat. Today, I will concentrate on the first scenario where there is pregnancy test positive, but there is no pregnancy sac inside the womb. This is known as ectopic pregnancy. It can happen in the fallopian tube, in the lower part of the womb, which is known as cervix, in the ovaries, as well inside the abdominal cavity. 90% of the ectopic pregnancies are in the fallopian tube. Now, if the fallopian tube is damaged, commonly due to some infection, and there is structural damage inside, the pregnancy sac gets lodged in it, gets stuck in it. It cannot progress inside the womb for further development. So it stays there, starts growing there. And because the fallopian tube is a very thin structure, it will finally rupture, causing torrential hemorrhage inside and can lead to the death of the mothers. Many mothers have died of this condition all over the world, including highly developed medical worlds. Like in USA, UK, etc. I have encountered several such cases. When I was in England doing a locum job in Greenwich Hospital, London, there was a very interesting case about which I have talked in details in one of my shorts. Please go ahead and watch it. I have got frantic calls from the ultrasonologists, ultrasound departments that there is an ectopic pregnancy, please immediately take some action. I have come across patients who have collapsed on the road in early pregnancy, and the final diagnosis was ectopic pregnancy. So how do you diagnose ectopic pregnancy? If the pregnancy test is positive and the ultrasound shows there is no pregnancy sac inside the womb, the suspicion should be high, because it's a very, very frightening condition, life-threatening condition, and like hit you like totally unawares. In a very interesting phrase is used in one of our medical textbooks is that ectopic pregnancies are like black cats in a dark night. When it leaps onto your face, it's too late. So you have to be high degree of suspicion in early pregnancy, especially if there is a lot of abdominal pain in the mother or there is some bleeding. So we do a pregnancy test positive, but no pregnancy inside the womb, then it can be ectopic. If the pregnancy hormones beta HCG stays around 1000 to 2000 units and repeated ultrasound scans do not found any sac inside the womb, then it is possibly an ectopic pregnancy. However, the modern ultrasound, high resolution ultrasounds can pinpoint and detect even very early ectopic pregnancy before the rupture and leading to the catastrophic events. So if they say there is an ectopic pregnancy, we immediately have to deal with it. Normally what is done is that it's has to be taken out. That ectopic pregnancy, that abnormal pregnancy in the fallopian tube, in the ovary, inside the lower part of the womb had to be surgically removed. And that may mean the whole fallopian tube taking off or part of the fallopian tube removed. Sometimes, to preserve the fallopian tube, milking of this ectopic pregnancy is done, or rarely, in exceptional early cases, medicines can be used to tackle this condition. But always remember, ectopic pregnancy is one of the deadliest form of pregnancy, and if there is a high degree of suspicion or if there is a definitive diagnosis, the action should be taken immediately. Otherwise, we may lose the mother.